I'm Dr. Michael Miloro, and today I'm going to demonstrate clinical neurosensory testing of the inferior alveolar nerve. These are the instruments we use for clinical neurosensory testing. For two-point discrimination, we use these two-point discriminators. For brushstroke directional discrimination, we use a fine camel hair brush. For contact detection, we use a series of Sem-Weinstein monofilaments or von Frey hair filaments. For thermal discrimination, we use ethyl chloride spray on cotton tip applicators. And for super threshold pinprick nocioception, we use a 30 gauge needle. Based upon this publication by Zuniga et al. In the Journal of Oral and Maxillofacial Surgery from 1998, we are able to use the 3-level dropout algorithm using 5 neurosensory tests to determine a level of neurosensory function classified as normal, mild, moderate, severe, or complete injury. Of course, today we are using the Medical Research Council scale, which determines a level of functional neurosensory recovery classified as either an S3, S3+, or S4, with an S3 characterized as a two-point discrimination threshold greater than 15 millimeters, an S3+ with a two-point discrimination of 7 to 15 millimeters, and an S4 indicating complete recovery with a two-point discriminatory threshold between 2 and 6 millimeters. We divide the lower lip and chin into 4 quadrants based upon the midline and the labiomental fold, such that we have 4 quadrants in which to test. In general, we begin by testing the control side to establish the baseline. Subsequently, we alternate our neurosensory testing to the injured side to determine a comparative level of neurosensory function. We would, in this case, begin in the patient's left upper quadrant, then proceed to the right upper quadrant, then establish the baseline in the left lower quadrant, and proceed to the right lower quadrant. So we're going to start out the testing with two-point discrimination. The patient's eyes are closed, and I'm going to start on the uninjured side, or the control side. In this scenario, we're assuming that the right side is injured. So I'm going to start with approximately 5 millimeters between the points and ask the patient, do you feel 1 or 2?
1.
If she says 1, then I'm going to go wider.
2.
2. So 6 is the threshold. Then I'll go over, again, staying in the other quadrant on the upper, 1 or 2.
1.
And then I'll expand out, 1 or 2.
2.
2. So 6 normal on the control side, 7 on the abnormal side. Then we have to go down to the lower quadrant, and I might start at 6 down here, so 1 or 2.
2.
Okay, and then we'll go over to the injured side.
2.
Okay, so that would be the same on both sides. The next test is brushstroke directional discrimination. Again, with the patient's eyes closed, I'm going to have divided the lower lip and chin into 4 quadrants based upon the midline and the labiomental fold. And I'm going to compare the upper quadrant to the upper quadrant and the lower quadrant to the lower quadrant. So in the left control side, I'm going to ask, am I brushing towards the right or towards the left?
Right.
Okay.
Right.
Okay, so I'm going to try that again.
Right.
Right. And then I continue that for 10 attempts and determine the number correct out of 10, then go down to the lower quadrant
Right.
and
Right.
good. Then for contact detection, I'm going to start out with the Sem-Weinstein monofilaments, and generally I'll start out with the 2.83 to determine whether or not there's sensibility. So I'll put some pressure until I could bend the acrylic rod and ask her to tell me when she feels something.
Yeah.
Yes?
Yeah.
And then in the injured side,
No.
no. So then I would go up one size to the next size of 3.22 and go back to the injured side.
Yeah.
Yes, she feels that. And then again, I would go to the lower quadrant
Yes.
with a 2.83, and then the injured side,
No.
no. And then with the 3.22,
No.
and then I go up one more to the 3.61.
Yes.
Yes. For thermal discrimination, we're going to use superthreshold responses to ethyl chloride that's sprayed onto a cotton tip applicator. And again, with the eyes closed, I'm going to ask, what do you feel when I touch you here?
Wet.
Wet. And then on the other side,
Pressure.
just some pressure. So that would be a negative response. On the control side, in the lower quadrant,
Cold and
cold,
wet.
cold and wet. And here,
Wet.
wet, okay. And finally, for pinprick nocioception, I can use a 30 gauge needle or something sharp and ask the patient to tell me, do they feel sharp or dull?
Sharp.
And to the injured side,
Dull.
okay, that's a negative response. And
Sharp.
the injured side,
Sharp.